like, okay, I have my annual physical, I see my doctor for 2 minutes, and it's like I don't even have the time to ask a question. Whereas the way we do it is, we have the bandwidth to where we can sit on the couch and talk for hours if we need to, right? We build that trust to where, I hope that this is kind of a hot take, okay? I encourage our patients to go to Dr. Google or Dr. ChatGPT and look things up. A lot of
Mhm.
doctors really despise that. They're like, don't do that. It's terrible. I hope our patients, and you're an informed customer, right? It's your health. Ask
Mhm.
your questions and then come to us. We're the humans, that human touch, that relationship of like, hey, I was reading this. Is this on base, off base? Is this, crazy? Is it not crazy? And we talk through it, right? And that's what in the whole AI world nowadays, we still want to talk to a human, right? There's certain things that you can get from AI that you don't need a human, but when it comes to your health, I feel like this is a hill I'll die on. Is like everyone still wants a human to run something by.
Back, friends, to the Erie Wellness Podcast, where we explore a wide range of wellness topics, highlight the local professionals in our community, and encourage you to advocate for your own health and well-being. This week, we're stepping into a conversation around primary care, what it can look like when it feels more personal, connected, and supportive for you and your family. Today, I'm joined by Dr. Brad Brown, family doctor and co-founder of Strive Direct Health here in Erie. He's a physician, a business owner, and someone who is passionate about building meaningful relationships with his patients. In this episode, we'll talk more about direct primary care, how a membership model works, and why having more time, access, and communication with your doctor can make such a difference in your overall health experience. It's a thoughtful look at one approach to care and how to find what works best for you. Welcome, Dr. Brad.
Awesome. Thanks, Lauren. This is exciting. Thanks for the invite. I've heard great things and I love listening to your podcast too. So I'm honored that I get to be a talking head on it.
Yes, well, you came highly recommended as to someone who should be a guest on the podcast. So thanks for being here. As we start off today's conversation, I just wanted to start off with a fun icebreaker question. The question today is, what are you binging right now?
Ooh, what am I binging right now? Busy life with 4 kids. I don't have a ton of time to watch TV, but I am in an audiobook phase right now. Usually about once a year, I go through all the Harry Potter audiobooks. I'm a huge Harry Potter nut.
Mhm.
But lately I've been in a sci-fi fantasy type of realm as well. Brandon Sanderson, the Red Rising books, those are on constantly in my car when I'm driving around or working out or something. So highly recommend. They're phenomenal.
And
What
with
about you?
four kids, I'm sure you're always in the car moving.
Yep. We're like the team bus, like have all the kids in the back, the whole team. So I'll just put a ear pod in because they like to do their own thing. They don't want, me joining in on their conversations. So I'll just listen as we go. It's a ton of fun.
But we are currently binging season 2 of The Pit. Have you had a
Ooh.
chance to watch either one of those series?
Yes, the pit. For a long time, I used to say Scrubs was the most medically accurate medical TV drama out there, and it's obviously Scrubs is a hilarious one, but the pit is easily taken the number one spot for the most accurate TV drama. I work in the ER, and it's sometimes those episodes are a little too real. It's like, man, I want to come home and relax. I don't want to have to relive these things.
I know, but that's the reason why I was asking you this question is because I'm like, it is so intense. And is it real? Is it portraying like what trauma center can look like?
Yeah, I don't work in a level 1 trauma center like there. Like that's a whole nother level.
Mhm.
No pun intended. But I have worked in those before, and it is really intense. I mean, there's literally life or death situations in one room, and then the very next room, you have to go talk to someone who's had back pain for 20 years, and they just decided to walk in one day. And so
Mhm.
there's definitely it can be very emotionally rewarding, but also very emotionally taxing as well. So the pit is, it's really good. It's really good.
Well, for those listeners who haven't heard of The Pit, it basically follows a group of trauma ER doctors, nurses, but every episode is 1 hour. So throughout one season, you're watching a 12-hour shift essentially for these doctors and nurses. So it's a really good series. I was shocked. So Dr. Brad, for anyone in Erie who hasn't met you yet, can you share a little bit about your journey into family medicine and what led you to start Strive Direct Health?
Ooh, I'll try to be brief. So I don't have any family members in medicine. I have one uncle who I didn't really know very much growing up, who's a doc, but like I said, he was kind of a distant uncle. So I'm a little bit of the black sheep in my family and extended family. And I went to medical school as a blank slate. I didn't know what I wanted to be, what kind of doctor I wanted to be. I explored all the options. Early on, I knew I kind of wanted to start my own business. I had that entrepreneurial itch. And once I found primary care and family medicine more specifically, then it was kind of like, oh, it's too good to be true. I can start my own clinic and see patients, right? And then as I got further along into it, I saw the administrative burden that's put on primary care physicians within the health insurance system. And so I started trying to find a different way to still be a primary care doc and have my own business, and the direct primary care membership model. I found it, and it was like, yep, that's it. That's what I'm going to do. And so through medical school, and then, that was 4 years, and then 3 years of residency, I started laying the groundwork. I did residency here in the Denver area. And then started, getting everything ready for when I was out on my own. And we live in Erie. I found a spot right here down by the post office in Old Town Erie. Erie's been so good to us that it just the momentum started, and it's been an awesome ride for the past, 5+ almost 6 years now.
Did either you or your wife have family here in Erie, or?
We didn't. No, we moved here for residency. That's just the 3 years of training after medical school. Sorry, I'm mansplaining for anyone else out there who already knew that. And so we moved here for residency. And right when we got here, we knew we wanted to stay. And so we, like I said, we have 4 kids, and Erie's the best place to raise a family. So we knew we were going to stay.
So you're not just a physician, you're also a husband and a dad. So how has being a parent shaped the way you care for your families here in Erie?
That's a great question. Like I just said, having, when we moved to Erie, there's just something about it, right? There's this feeling that it's a lot of young, healthy families is kind of who we got to know through the rec center sports and all those things. And being, I like to think I'm a small town doc, right? Erie, sure, it's a small town, but it's, we're close to Denver, close to Boulder, close to everything. And so it's not really a true rural small town doc, but it's, seeing all the friends and family in the community, and then, taking care of them in the clinic as well. And being a father is like, hey, I'm just treating people I know and love already, right? That dovetails beautifully into our model of we know our patients just like their family, right? I mean, I just had a conversation 20 minutes ago in our waiting room with some patients who our kids played on the same basketball team together, and then for the past couple of years, and then they were asking, oh, what are you guys going to do for the summer for basketball and things like that. So it's sure there's little cliches of it's like having a doctor in the family or a doctor in your pocket or something, but it's true. I love when people ask me like, hey, just a quick question about, my kid has a rash, or, I have a cough or something like that. It's like, yeah, it's a level of trust. It's a convenience, and that's what we do. And I love it. I absolutely love it.
Well, it's fun to see you being able to just live life with your patients. Yeah. And it's great that so many of your patients are in the same season of life too that you're in. And then it'll be cool to see everyone kind of age, and eventually it's like, where does your kid going to college? Those kinds of conversations. So
absolutely. Awesome. Our PA actually, a point right here, because she's on the other side of this wall. Her oldest is graduating Erie High, and she's going through all of that right now. And there's definitely some emotional swings with that. So I'm looking forward to it, but not looking forward to it.
So you said something that I love when we first had our introductory call, which was find a doctor that fits your vibe. What does that actually mean, and how can someone tell if it's the right fit for themselves or their family?
Yeah, so I tell that to people all the time, because your health is not one size fits all, right? That's kind of how we view it, to where sure, there are medical studies that are, evidence-based medicine, which is phenomenal. That's how, things progress. But, and there's guidelines and everything like that. But maybe you're asking, I'm saying you, it's not you specifically, Lauren, but you out in the ether. Maybe someone's asking a question that is not, quote unquote, fits directly in those guidelines or something like that, right? And so finding a provider, a doctor, a NP or PA, someone that's on your health team that kind of you click with, that you have the similar trainings of thought with, have similar views, right? To where you feel like you can build that relationship and have that trust, to where you can ask the hard questions. You can ask the questions that you might feel silly asking someone else, right? To where, you don't, like, okay, I have my annual physical, I see my doctor for 2 minutes, and it's like, I don't even have the time to ask a question. Whereas the way we do it is, we have the bandwidth to where we can sit on the couch and talk for hours if we need to, right? We build that trust to where, I hope that this is kind of a hot take. Okay. I encourage my patients, our patients, to go to Dr. Google or Dr. ChatGPT and look things up. A lot of doctors really despise that. They're like, don't do that, it's terrible. I hope our patients, and you're an informed customer, right? It's your health. Ask your questions, and then come to us. We're the humans, that human touch, that relationship of like, hey, I was reading this. Is this on base, off base? Is this, crazy? Is it not crazy? And we talk through it, right? And that's what, in the whole AI world nowadays, we still want to talk to a human, right? There's certain things that you can get from AI that you don't need a human, but when it comes to your health, I feel like, this is a hill I'll die on, is like everyone still wants a human to run something by. And so that's what we do. The team that I've assembled here is, for some reason, all female. I have yet to hire a male. We have 5 females just because they're phenomenal and they were exactly the perfect person for the job. But between Dr. Schuster and Alexis and Kimmy, our nurse, and we have another doc, Caitlin, she's starting in a couple months. But we try to have as many different vibes here as possible for as many different type of people.
No, you bring up a really good point. It's advocating for your health. It's being an informed patient and not being afraid to question even your doctor. Like you know what's best for you, or you should have an idea of what that looks like and what you feel good about. So making sure that you and your doctor fit that right vibe together is really important.
Absolutely. Yeah. And if you there's some people who need a very direct doc, like, hey, do this, do this, do this. Other people maybe a little bit more around the bush or a little sugar coated, and it's just finding who you fit with. So that's I couldn't agree more. I want my patients to challenge me. That means they're thinking. That makes me think. I want to think too. So
we're going to take a quick break from today's episode to hear a word from one of our sponsors. Additional support for today's episode comes from Bridge Refill Market, Erie's local refill shop, helping families reduce waste one refill at a time. As of this month, May 2026, the community has helped save over 28,440 containers from the landfill through refills at the shop. From laundry detergent and dish soap to organic bulk foods and personal care products, you can bring your own containers and refill only what you need. Learn more at bridgerefill.com. Now let's get back to today's conversation with Dr. Brad Brown. When you have that open dialogue between patient and doctor, what does it really mean to be and feel heard as a patient? And how would you coach someone who feels like something is off maybe with their care, but doesn't know what to say?
It's really hard to feel heard in a rushed 4-minute appointment where you're sitting on this table with crinkly paper and it's freezing and the doc is looking at their computer, not at you, right? And so I think that all starts with time and in a comfortable environment to where you can express those thoughts and feelings and desires and all the research you've done on what you're thinking about your health and everything like that. And so it comes down to time, and then have that relationship to where, whether that's through a text or a call or an in-person appointment or whatever it is, feeling like you can ask those questions and hey, I don't really know what I'm trying to ask, but maybe you, Dr. Brown, have heard people try to ask this question. What do you think? Or something like that.
Mhm.
And we go back and forth. Are you thinking this? Are you thinking that? Or, hey, these are the recommendations for, the 95% of people, but maybe you fall outside of that. But being heard is time, and that time is not just here in the doctor's office either. It's at home when you have that thought, oh, I'm going to shoot Dr. Brown a quick text. Hey, follow up about what we talked about last week. This is what I was thinking. Awesome. We have that. We've continued the conversation. So I think it all just comes back to relationships and having the bandwidth, the time to be heard, if you will.
Mm-hmm. So how long are your appointments? Does it vary? Really vary?
Yeah. Anywhere from 10 seconds to an hour, hour and a half. Depends on what people need. To freeze a ward off takes 60 seconds, but someone maybe for a hormone discussion, male or female, can be a little bit longer. Dr. schedules her annual physicals and Alexis for, the women's annual wellness is a full hour. Sometimes it takes more, sometimes it takes less, but all of our patients know they get the time with us when they need it. So it's whatever the people need.
And inside of an insurance-based model, how much time do doctors really get based on your experience?
So you're just building my soapbox for me, and I'm going to try not to go crazy. So in the fee-for-service insurance-based world, then upwards of 75 to 80% of all revenue brought into a clinic goes to overhead, right? And so the physician has to see between 30 and 40 patients per day just to break even for the clinic, right? 30 patients per day over, an 8-hour workday, which is probably not realistic. It's more like 10 hours, is 3 to 4 patients an hour, but that includes all of the paperwork and documentation, everything. So all in all, I think the studies show it's between 5 and 7 minutes with the doc. We've all been there before. I've been a patient too. The doc is sitting there typing at their computer, not even looking at me. And I call them out on it all the time because, I'm on my high horse about this, but it's the insurance system the insurance-based healthcare system is built exactly how it's supposed to function to profit the insurance companies. It's not supposed to keep people healthy. So that's for a whole nother podcast episode. We'll have to go down that route, but
but you're looking at less than 20 minutes,
Oh, by far. Yeah. When I was in the insurance system, then, I would have less than 10 minutes with patients and I would be running behind all the time. It would just accordion behind. Every patient would be more and more. I would be later and later for each one throughout the day.
So for someone who's new to this membership model in primary care, how do you get the most out of it at Strive? Can you explain it so that they understand it a little bit more? And what tends to surprise people once they join?
We do. I'll answer your question with a question, right? Do you take my insurance? I get that all the time. It's like, I used to say no, but that just puts people off right away, right? So my answer all the time now is you can have any insurance you want. We just don't bill it, right? We always recommend having some type of coverage. It was actually one of the community questions I'll just loop in here too. It's like, hey, is this a good option for someone who has little to no insurance? Like, absolutely, we're a great option. We are not technically insurance. We're primary care, but for $55 a month for kids and $105 a month for adults, then we pack as much into the membership as possible. You can see any of us providers. You can, we do acute visits, chronic things, annual things, sports visits. We pack it all in, and there's no co-pays, there's no extra fees, anything like that. And so how do you get the most out of it is we're like Netflix is kind of what I say, right? Sometimes you binge. And so you watch a bunch, you binge The Pit for a few nights in a row. And then other times you're not watching for a few weeks. Our patients love that, to where they can just text. They're busy on the go. It's like, hey, I threw my back out at work. What do I do? It's like, sweet, here's the things. If this doesn't help, I'll see you tomorrow, or I'll see you next week, or whatever. Same day, next day appointments all the time. We like to call ourselves comprehensivists, not generalists. Basically try to do as much within that membership as possible. We have a great community of specialists that we have on speed dial, that if you need to go see a cardiologist, I can just call one, run your case by them. And if they think, hey, this is something that they need to see in their office, we'll schedule an appointment. If not, then they say, hey, do this in your office, saves you a trip, right? And so it's basically trying to work within the system of, hey, utilize this membership. I'm here to advocate on your behalf. I can quarterback your health if you have a bunch of chronic illnesses. If you only come in once a year for an annual, we'll do that. And then you just text me any other time of the year if you need stitches or you need, a quick antibiotic or something. It's a true membership. It's how primary care used to be when docs would work for their patients, because that's what it is. I work for you as the patient. I don't work for an insurance company. So of safety, let's take care of you with what you need, what you're hoping to get out of it. You're a consumer. I'm providing a service is what it comes down to.
I love that analogy of like, you're the quarterback. And even like you go see the cardiologist, they come back with all this verbiage that you have no idea what it really means because they only had a certain amount of time to talk to you about it. And then you're like, what do I do? Like, what does it mean? And then you have time to actually like sit down and like explain it better to them as well.
Yeah, we do that all the time. I love that stuff. Play translator.
And another side service that I think you guys offer is you do ear piercings too, don't you?
We do. Yeah, we do free ear piercings for our members. And I think it's $95 or something for anyone who's not a member.
For non-members. Okay. I was talking to another parent and they were like, we have 3 girls. So one of our girls was getting their ears pierced, and they were like, did you know that Strive offers that? And I was like, I had no idea. And we go to a tattoo parlor in Lafayette or Louisville, and it's over like $200. So your option is much more affordable compared to that. So,
and nothing against the tattoo parlors, but I have young kids as well, and taking them to a tattoo parlor is a little different experience than going to a comfortable doctor's office, right?
Yeah. But I thought that was cool that you guys did that. It's a nice little added service too.
Yeah, it's tons of fun. We do those, and it's just a win. People are like, I love it, so why not?
So, you come in for colds, primary care, all the general things. You said you do hormones. Anything else that we're missing maybe that you haven't covered yet?
I mean, we offer free sports physicals for any Erie athlete that wants them. We do. That usually happens in the fall, right before school starts, when everyone needs to get those in. We do, I love doing stitches, ingrown toenails. I mean, you name the primary care, we do it. We're between the 3 and 4 of us, we can take care of everything. All the, men's testosterone, women's hormones. I mean, we try to pack it all. We hear what people want, and we, again, within the realm of safety, try to work it into the membership. So it's not like you have to go to a low T men's clinic and pay $300 a month for that. It's like, no, well, I can be your primary care doc and I can manage the testosterone for you. That's within primary care. Another hill I'll die on. I'm a firm believer that women's hormones, hormone replacement therapy or HRT or menopause care is primary care. And so why would I charge extra for that? Right? It's like that. That's a gender tax. And I'll charge the men all day for testosterone. I'm just kidding. I don't do that either. No, I think primary care things are primary care, right? And so why there's no nickel and diming. Everything's super transparent. If someone asks for something, we have wholesale medications that we prescribe out of our office. So, blood pressure, antibiotics, antidepressants, everything like that. It's all wholesale costs. We don't make any money off that. So saves people a ton of money. And to go back to your very first question, what surprises people when they come in is how affordable the healthcare system really is. Whenever you peel back that curtain of opacity of like, oh, I can get my albuterol inhaler for my son to have in his bag at soccer practice. It's only $9. It's like my copay was $25 at the pharmacy, which with my pharmacy benefits, it's like, yeah, I'll just pay you $9. And that's I don't make any money off that. Right. Supplier. So people are always surprised with how inexpensive things are when they have access to those prices.
So do you ever submit things to like Walgreens, or does it always come through?
Oh, yeah. A lot of people still want things through and all controlled substances like the Adderalls and the Ritalins for ADD and ADHD. Those still have to go through the pharmacy. I can't dispense those. I could, but it's a lot of red tape and it's not worth it. There are some pharmacy benefits that people have $0 copay. So it's like, sure, you're already established at the Walgreens or the King Soopers. I'll just send it there just like normal. That's not a problem at all. I mean, it's no different to me because I don't make any money either way. So it's whatever's easiest for the patient.
Okay. This might be an insurance question that people would ask, but do you guys do super bills?
We do, yeah. But the follow-up to that is it's usually not worth it.
Okay.
We'll fill it out and the patient can submit it, but insurance companies won't reimburse for a membership. They only reimburse for a visit. And so I'll fill out, 99214, whatever it is, and here's what we did. They'll submit it and they get like $12 back or something, because
Okay.
health insurance companies are the best.
And it probably takes forever to even get processed.
Usually takes about 90 days. Yeah. Okay. So people ask for them, and sure, happy to fill them out. But we always say, usually people do this once or twice and then they're like, no, it's not worth it.
So one of the community questions was, how can we be cost conscious with a subscription and carrying insurance? Can you answer that question for the listener?
Yeah. Common question. Usually it comes from, someone has the Excel sheet, their family expenses Excel sheet right up in front of them. Like, why would I pay $1,500 a month for my insurance? Because it's ridiculously expensive. And then still pay, $200 a month for Strive for my family or something like that. First part of that answer is we always recommend having some type of insurance coverage, whether that's through the general marketplace, whether that's through a health share plan or something like that, because accidents happen, bike wreck for the kids, car wreck for adults, things like that, to where you need that coverage. We fill the gaps for the primary care piece. But for the cost conscious families is, first of all, we don't charge beyond 2 kids. So if you have, 2 adults, 2 kids, every kid after that is free, because I didn't want to, we have a bunch of families with 5, 6, we actually have a family with 9 kids as well. So it didn't feel right. I grew up with a ton of brothers and sisters too. Didn't feel right charging beyond that. But it really is, if you get into the numbers of, if you just go with the normal general marketplace plan, you're paying, let's call it $1,000 a month. That's $12,000 a year, right? Plus a $5,000 deductible. So then there's $17,000 a year. And this is on the conservative end, $17,000 a year before anything is covered, right? You're self-insuring for $17,000 a year before anything. Then usually there's denials and things that don't get covered after that. Plus there's copays, plus there's pharmacy copays. So you could be $20,000, $25,000 a year before anything's covered. Whereas if you go for a high deductible or a high deductible HSA plan, you have a lower monthly premium. You use us at Strive, or you use a health share like Zion or Sedera or something like that. I have no connection with any of these companies, just a lot of our patients use them. You go with one of those plans and then you use us at Strive, then the money is, the bright glaring light is monthly, this looks like a lot more. But the savings on, okay, if you need stitches, that's $500 and 3 hours at urgent care, where we could just get you in and out in 20 minutes and you're back on the job working, right? No extra cost for that. There's $500 of saving right there, right? Your kid has a cough, they need a school note. Sure, we type it up, piece of cake, there it is. You need to bring them in for a rash. Here's a quick ear infection antibiotic, done. Strep throat, that was all the rage this year. Strep throat and flu was crazy. And it's the savings, the cost savings are there. It'll be relatively the same, except for the fact that, there's a huge time savings as well. And so there's more than just the monetary piece of it. There's a convenience, there's time savings, there's, for people in the trades, they get paid when they work, right? When they complete a job. And so just the other day I had a guy turning a wrench and he cut his hand open. He came in, stitched him up, and he was back at the same job with travel time in under an hour, right? I love that stuff. That's what gets me going in the morning. So cost conscious, it's actually, there's a lot more money saved by being with a direct primary care, not just Strive. There's a bunch of DPCs in the area because of the access is what it comes down to. You can save the time and the money just because, I don't need to go to urgent care. Or, hey, I called Dr. Brown. Hey, I'm feeling this. Do I need to go to the ER? No, actually you don't. I can see you first thing in the morning tomorrow morning. Save $5,000 when you were like, I probably would have gone to the ER, and then they would have said, oh, you didn't need to come. We all hate that. We've all been at that point before, but we are the ones that know you. We know, like, we're the ones triaging. Do you need to go or do you not? Do we need to see you today, or can this wait until first thing in the morning if it's 6 o'clock at night? So there's a lot of savings that are implicit, if you will.
Alrighty. Well, thanks for answering that listener question. We have one other one, which is a little bit more, I guess, technical, but the question is, what recommendations do you have for a whole body scan? It's great we have the technology, but they're so expensive. If someone was going to do it, should they do it the entire body from head to toe and look at everything, or are there specific recommendations for a middle-aged woman or somebody that's in their 50s?
Yeah. For someone who's like, hey, I have a family history of XYZ, sure, go get a scan, and pair that with the other information as well, so it's not standalone, and it can be useful at that point. So I don't ever say a direct no. I just like to have that conversation of like, it's probably not like something we need to do. It's if you think of concentric circles, there's the smallest one is all the primary care, get your colonoscopy, get your mammogram, get your pap smear, all those things, get the blood work. It's probably one or two circles out from that of like, yeah, we could do it. It's good information to have, but just know that there's probably going to be an incidental finding that you'll know you have, but we don't need to follow it up. It's have a cyst or whatever it is. So it's kind of the specifics on a full body scan. I got one just because I was curious, and it was not really head to toe because I'm so tall. It was more like nose to shin. Yeah. It was good. And the
missed the brain, but it's okay.
The bottom half of my brain. So,
well, and I know too, you're also just having the discussions with your patients of like, are your like foundational like health needs being met? Like, are you sleeping? Are you eating a well-rounded diet? All those things. So, what's your talk to your patients there?
I'll break it. I'll be very brief on this one. Life is motion. Motion is medicine, and it starts and ends in the kitchen, right? And so if you're eating fast food 4 meals a day and you're getting 1,000 steps, we have things to work on, right? If you are an ultra marathoner and you're an extremist in that route, we have things to work on, right? And so, but the more you move, the healthier you are, and the more balanced of a nutrition intake schedule that you have, then the healthier you are. So it all comes down to those.
No, great way to put it.
So there's actually another community question that I'd like to ask. I would love to see doctors start acknowledging MTHFR mutations and how it affects the entire body. Most patients are left to find the answers on their own or through expensive functional medicine doctors. It would be nice to have someone local that takes this seriously and understands how dietary choices are important to overall health. In addition, low ferritin numbers are concerning. Why do so many children have low ferritin numbers, and why is this not a standard test for everyone? That's a great question, multi-layered question, and a little bit technical on the medical advice piece. So please, everyone, just plug your ears if I start mansplaining again. The MTHFR gene mutation, that the whole concept and principle behind it is really growing some legs in the medical community over the last few years, and I think it will become a little bit, definitely more of a standard of care discussion in the next few years. But right now, the people who have that mutation and are tested for it and eat a balanced, nutritious diet usually don't show any symptoms. And it's more theoretical for down the road if that mutation even causes any dementia or things like that. It hasn't really been able to be replicated in the studies that is an issue. Obviously, we need the folic acid for the first 4 days after conception or whatever it is. I'm not great on my epidemiology anymore, but having that, taking the prenatal vitamin and making sure that the neural tube closes, everything like that. Cat's out of the bag on that one if we're already born, so we can't really go back on that. But we, like I've mentioned previously, we have the time and the bandwidth. We're open-minded. We have that conversation. It's a harmless test to order. And so, yeah, sure, we can order that all day. And we do. And we have the discussion with patients like, hey, if you do come back with that, sure, take some methylated folate or some demethylated folate. It's not going to cause any harm within realm of reason. So having being open-minded to have that discussion and feeling like we talked about at the very beginning of the episode of feeling confident and comfortable asking that question, ask away. We can it falls in those concentric circles, right? How far out do we want to go from the quote unquote standard primary care nuts and bolts piece of it? So yeah, we order that. We have that discussion multiple times a week.
Well, thank you for answering that for the listener. And of course, if they have any follow-up questions, don't hesitate to reach out to your office and
Absolutely
explore options. So we've talked a lot about families, but I know that you also partner with local businesses. What does that look like, and why are more companies exploring this model for their employees as well?
Yeah, so a lot of companies, they're doing well enough, small businesses, they're doing well enough that they can have employees, which is awesome. But then they don't quite have enough revenue to offer a full quote unquote normal benefits package with, a Kaiser plan or, something along those lines. And so we offer our membership basically at a slightly discounted, at a discounted rate for employees and business owners, to where they can use us as a benefit, right? And so restaurants are notorious for having really high turnover. We have a couple of restaurants sign up their people with us, and the people love having us as their quote unquote health benefit, even though we're not technically insurance, right? And so it's a way to provide direct primary care and primary care to people who are, hardworking and make more than Medicaid allows, but not quite enough to where we can afford the incredible astronomically high rates for health insurance. That difference is growing, right? The Medicaid all the way up to what can be afforded. And that's a pretty big gap. It's not a safety net by any means. And so, we have a couple landscaping companies that use this as well, because their guys, we keep their guys working. So if they have, like I said, they're turning a wrench and cut his hand, or he's needs a quick sick visit or something like that. So it allows them to lessen their turnover, because turnover is the most expensive bottom line item for any small business. And it's a ton of fun. It lets us help support local businesses, right? I mean, sure, I could write a check to support the local business, but that is not nearly as fun as actually using my training and skills to help support them. I mean,
it's a great option. My in-laws, they own a business, and I know that insurance is a pain in the butt for them every year, and then rates increase, and then they're shopping around. And I mean, I could go on and on about the stories that I hear at dinner. So
yeah, we'll do episode number 2. Yeah. Okay. But no, it's good. It's a lot of fun. It allows us to support local businesses and take care of their people and keep them working.
Absolutely. Okay. As we wrap up, I'm curious, how did you come up with the name Strive Direct Health?
No one asked me this question. I'm so glad you did. So I kept a list for years and years of potential practice names. I ran it by as many different people as I could. I didn't try to hide it at all, right? I took an example from Warby Parker, and I was like, I just want as much feedback as possible, even if it stings, Can't tell you how many times at night after we put the kids to bed, I'd ask my wife something, and I'd say, hey, what about this? She's like, no, not a chance. I'm like, okay, well, it's like naming our kid, right? Asking everybody I saw, what do you think about this? How does it make you feel? Anything like that. And so I wanted something that was, like peak or apex or a continual journey, because your health is not a destination, right? I mean, it's every day, every week, every month, every year is changing and evolving and adapting. And so striving towards optimal health it's not a straight line, right? So I wanted, it's not up or down. It's just constantly going. And so I wanted something that was along those lines, and strive was too good of a word to pass up. And then direct, obviously, because we work directly for our patients. There's no middleman at all. And then health, pretty self-explanatory. So direct health just kind of came together nicely.
Well, I'm glad I was the first one to ask you that question.
Yes, so. You should feel honored, or I should feel honored. I don't know. How does that work? Yeah.
Well, and I love it because, when you're a business owner, like, your business is your baby. So even just coming up with that name, it feels like a lot of pressure. So how can people take the next step if they want to learn more about your practice?
Yeah, just on the web. They can always reach out. They can text or call me directly. They can email me, just Brad at Strive Direct Health. They can call us. It gets right to me. Same with text. On the website, there's a lot of information on our website. If they want to schedule a free meet and greet, see if we're the right vibe, then absolutely you can. There's a scheduling tab on the website. You can self-schedule. You don't have to be a member to do that, or a patient. Or if you want to jump in and go whole hog, then there's a join the family button as well, to where they can sign up on the website as well. So it's pretty easy. Call me, text me, website me, whatever works.
Mm-hmm. And I love that you guys, I mean, we're a family of 5, so I appreciate that, after those 2,
Yeah.
you're all included. So that's great. Well, thank you, Dr. Brad. I love that this conversation gives our community more options and just a better understanding of what's really out there. We really appreciate you taking the time to educate and share with us today.
Thanks for having me. This is a blast. We'll have to do it again soon.
All right, friends, before we wrap up, here's the part I need to share. This podcast is for educational and inspirational purposes only. I'm just your friend behind the mic. Nothing shared on this podcast creates a patient relationship with any of our guests or replaces the guidance of your physician, professional coach, or other qualified expert. And the views shared by guests are entirely their own and don't necessarily reflect the beliefs or values of the Erie Wellness Podcast. My goal is to simply create a space for real, open conversations that help us all learn, grow, and feel a little more connected on our wellness journeys. Thanks so much for listening. I'll see you back here next time. Thank you so much for listening to today's episode of the Erie Wellness Podcast. If something from this conversation resonated with you, I hope you'll take it with you into your week or share it with someone in our community who might need it. To subscribe, just head to the main page for the Erie Wellness Podcast, right where you're listening, and tap subscribe. And don't forget, when you start to feel better, you start showing up better in all areas of your life, and you deserve that.